Hey everybody, happy Friday. Yes, it is Friday. This is Angela McGowan, and let me get my banner that I thought was on. Anyway, I'm Angela McGowan, a professional healthcare advocate, caregiver strategist, and founder and CEO of Angie's Pace. That's patient advocates committed to excellence. And so, you know what I'm doing? I'm going to attempt to bring more people in for this information. I would love for you to join me if you could share this broadcast and let people know that we are here. And then, of course, if you love this platform, you'd like to use it, you could go to bit.ly/stream for you. And then you could be my guest with the code that's there at the bottom. So if you would be so kind to do that. And we're going to get right into it. Me and the spell check. All right. Thank you very much for being patient and for inviting people and letting them know what we are here doing on today. So, yes, I am Angela McGowan, the author and publisher of How, and this is every day, isn't it, people? How to Get Out of the Hospital Alive. This is my book, and you can get it today, $12.99 at bit.ly/to get out alive 1220. So we're going to be doing some reading from that, but first I wanted to give you an update because yesterday we said 24 days, today's the 25th, 25 days into 2019. We still have the 3 blood pressure meds that were recalled, 2 of them in less than 7 days. So I wanted to give you an update because I've been talking to people, calling people, texting people. So someone responded back to me and said they did call the pharmacy, but then they went and took the medicine down there. When they called, the pharmacist assured them that their medication wasn't part of the allotment. They, but they took the pills down there, everything that the doctor prescribed for blood pressure. And one of those things prescribed was a water pill. So they went to the pharmacist checked it, went back over the allotment to make sure, and says, no, we do not use that manufacturer for these particular medications. All right, so they were very happy. But they also said, well, what is this other pill? It's my water pill, because they wanted to have everything that they picked up at that same time. And the pharmacist looked at the bottle and then looked at the pills and said, hold on a minute, and went to the back and came back and said, well, there's an error in this allotment. And they said, what do you mean? So this medication on the label, on the bottle that we use and the one we put here said 15 milligrams. I'm sorry. On the allotment, it says, 25 milligrams. And that's what their bottle said because they're supposed to get 25 milligrams. But the pharmacist says, but I know for a fact that this pill is only 15 milligrams. See what I'm saying? This is what I'm talking about, being a powerful patient. Now, they went there because of blood pressure medicine, and in their great sense of being powerful said, let me just take everything I got that day. And when they got there, they were notified because, of course, the pharmacist looks at these medications every day, is very familiar with them, and said, this is done wrong by the manufacturer. This pill is a 15 milligram, and you were prescribed 25. So let me just say, of course, they were able to get the right ones, but this is very important. It could have been in reverse. They could have been taking something too strong for them, because you're probably saying, oh, they could have been taking something too strong. They could have been should have been taking 15 and got 25. But Here's the key about being a powerful patient. If you're taking a medication you've taken for a long time, and for some reason, after 3, 4, 5 days, you don't get the same results, you need to go back to the pharmacy and do a check on that. If after that, the pharmacist says, okay, you need to go to your physician and say, this is not working. And find out, is it a diet? Is it another pill you're taking in combination with it that has brought what should be happening down? But don't just accept, it's not charade, sounds like, could be. Don't guess with your health care. This is your life. You're supposed to be accountable and responsible for. Please do so. I'm asking you that. And so that is why I have been talking to you all this year about being part of the Powerful Patient Movement. It's a free Facebook group. We are talking about how to become, you are going to develop into a powerful patient. We want you to stop being a doctor's patient and move to the realm of being a powerful patient. A powerful patient is positive, passionate, prepared, persistent, and on purpose. All of those things we're going to be helping you to develop as you become a powerful patient. And what I really want you to know about the Powerful Patient Movement is that we have a definite message. And the message is the acronym Y-Power. And that is, your providers owe you, that's you the patient, wisdom, ethics, and respect. That's the message of the Powerful Patient Movement. And I want you to make sure that you are a part of that movement. Another thing I want to talk to you about is, of course, please, it is not too late for you to be a part of the 10-day self-love challenge. It started just this past Tuesday. You have time. What is the challenge about? What you do is you have 10 days to schedule a complete physical with everything in it. Get that done. And I'm asking if everyone would push and get it done by the day of love, February 14th, because we're talking about self-love, right? So why not have this end on the day of love? And to just keep you informed and ready with what we're doing every day, especially in the Powerful Patient Movement, you're going to see something about giving self-love. The first day was, of course, about making the appointment. The second day was, of course, taking your meds to see if you're safe, making that happen. The third day was to write down 3 good things about yourself. You should be having a reflective journal to continue to make you feel positive and encourage you. And today, the 4th day, and I had it round. Isn't that something? That's how it goes. The 4th day is to engage with positive people. Get yourself some positive friends, okay? Pull them into your circle. Check your circle. Thanks for joining. Check your circle. If your circle is not positive, you need to switch people. Come on, get somebody else. Because there are people who are positive looking for other positive people. So again, I'm going to remind you to come on and be a part of the Powerful Patient Movement. This is our message. Your providers owe you wisdom, ethics, and respect. And to be a part of that, you simply go to bit.ly/the Powerful Patient Movement. And so I did tell you could get that book. If I didn't, let me tell you, you can get this book at bit.ly/to get out alive 1220. So today, I want to read from another chapter excerpt that's called Identify Me, Please. This should be every patient's request. In the medical field, there is no one item that is more important in every facet of healthcare than patient identification. The patient's very life and recovery can happen, or a life can be lost if patient identification does not take top priority with all those that work with patients in every capacity. That's why I say your providers, and that's all of them. This identification is important, not just in medical offices, but also in hospitals during the pre-admit process. In skilled nursing facilities, when a patient is transferred from inpatient and transitioning home, the surgical centers, and the vast amount of procedures at the procedure centers that may specialize only in one procedure. That specialty still, that patient must be identified right in the correct manner to make sure they have the right person getting the right procedure on the right body part. Hello. The imaging centers must also be careful as imaging order not only covered on a specific body part, but there may be special allergic reactions that prohibit certain types of IV contrast to not be given to the patient at all. What about the labs, be it urinary or blood draws? The right testing on the right specimens to return complete and qualified results to treat the right person. Here are the 8 patient identifiers that providers should use as part of their patient safety requirements. Your provider asks for and should require at least 2 of them before they service you. Your name. They can ask for your medical record number, or they can call it an ID number, your date of birth, your phone number, your address, the last 4 digits of your social security number, a photo ID, and what they call is a unique identifier. That is an alternate name. And alternate names are used very frequently by celebrity and high-profile people. If a provider does not request any of these patient identifiers, you powerful patient, must refuse service from them until they do. Although patient identification is a regular occurrence in the medical field, you may not have ever thought too much about this very small practical procedure not being done or in line with patient safety regulations, and what quite possibly you would refer to as a minor mishap if it happened at any of your provider's offices. Here is a scenario of what could happen with a patient that every caregiver should also be aware of and make it a priority in medical interactions. Take notice, remember, expect, and demand to be properly identified by every provider every time. It's example 1. You're in the exam room waiting for the doctor. He or she comes in to the room to see you and confidently call you by the wrong name. What could have happened? Is the label off the chart, smeared, and the letters not clear? No, not at all. Furthermore, this error has occurred because the chart is in the doctor's hand. It's not your chart. Were you adequately identified during check-in at the doctor's office, at the reception area, and then again at triage? When the triage nurse comes in, she's supposed to go through the same thing. She should, or he should ask you for at least 2 identifiers. So now I'm sure your confidence is a little shaken, because after all, if you don't know my name, how are you going to give me the right diagnosis? How am I supposed to believe that those test results I came for are actually mine? And so that is what happens inside of this book Look at me. Look at it. Inside of this book, how to get out of the hospital. Maybe I'll try this here. Okay. How to get out of the hospital alive. Because you don't want to go in the first place. But if you do, you want to go in with all the confidence, all right, that the doctor, the nurses, even the people that are admitting you, especially the people that are admitting you correctly. Hello. I want you to have a positive experience. I want you to understand as a powerful patient, it's your right to be identified correctly and refuse service if no one asks you at least 2 things, right? I gave you 8. There are 8 patient identifiers. At least 2 should be asked of you by every person that comes in contact with you, okay? All right, so I also want to remind you that this Sunday, that's right, this Sunday is Say It Sunday. It is Say It Sunday, and my special guest is going to be Elisa Wilson, and that is going to be awesome because she is going to be talking to us, especially caregivers, get this, about it have given us insight on being a patient in the skilled nursing facility. Now, everybody knows I've done a few lives about that, what's going on there. So she's going to talk to you. I'm going to interview and ask some questions about the preparation. Listen, the preparation about being in skilled nursing, it happens when the doctor tells you about your procedure and what's going to be happening afterward. You should not be surprised that you need skilled nursing care after your operation unless something happens in the surgery or something happens right afterward in post, and then you will find it out at that time. But there should be no surprises and no what? Not from the powerful patient. And that's why I want you to go to bit.ly/powerful patient movement and be a part of it. And don't forget to join me and Elisa Wilson. We'll be there together on Sunday at 5:30 p.m. Pacific Standard Time. If Elisa sent you the invitation, you know that's 8:30 Eastern Time. It is going to be 7:30. I'm sorry, 5:30. Yeah, 7:30 Central Time, 6:30 Mountain Time, and 5:30 Pacific Standard Time. Anyway, thank you for joining me for this segment on Facebook Live. I'm so glad to have time with you. And remember, if you want to know how to get out of the hospital alive, you're going to have to get my book. And it is absolutely available to you at bit.ly/to get out of the hospital alive 1220. All right. This is Angela McGowan, your professional healthcare advocate, caregiver strategist, founder and CEO of Angie's Pace, telling you that blessings and joy, that's what my wish is for you. They belong to you. Have a great Friday, a blessed weekend, and I'll see you Sunday on Say It Sunday, 5:30 p.m. Pacific Standard Time. Bye.